I'm now sharing the presentation. If you're unable to see it, please make sure you have clicked the link in the meeting invite. If you still have trouble, please comment in the chat box. Okay, let's get started. Good morning. My name is Belinda Perkins. I am a provider network representative with Ambetter from Arkansas Health and Wellness. Welcome to our second quarterly provider webinar. If you have any questions during the presentation, we ask that you can ask them in the chat box and we will address them at the conclusion of the webinar, or you can submit them directly to us at contact_us_provider_AR@centene.com and include provider webinar in the subject line. You can also send requests for certificates of attendance to the same email address and we will get one out to you. A copy of the presentation will be available on our website in a few days. And to prevent background noise, I will also request that everyone please mute your phones. Our focus for today's webinar will be on quality and incentives. We will cover such topics as HEDIS, provider data accuracy, member and provider incentives, and primary care physician auto assignments. What is HEDIS? HEDIS stands for Healthcare Effectiveness Data and Information Set. HEDIS makes it possible to compare the performance of health plans on an apples-to-apples basis. HEDIS allows for standardized measurement, standardized reporting, and accurate side-by-side comparisons. Physician-specific scores are also used to measure your practice's preventative care efforts. Your practice's HEDIS score can determine your rates for physician incentive programs such as the Pay for Performance program. The data collected is also used to identify areas which need improvement and focus efforts to improve the care and service to our members. What are HEDIS measures? The measures typically fall into three categories: adult health, women's health, and pediatric health. I'm not going to list all of the measures out, but you can find detailed HEDIS guidelines on our website under the Quality Improvement section of the For Provider tab. The guidelines include detailed code information related to each measure. On the screen, you can see a sample of the detail included for each measure from our HEDIS guidelines. So what can you, the provider, do to improve HEDIS scores? Providers play a central role in promoting the health of our members. You and your staff can help facilitate the HEDIS process by providing appropriate care within the designated time frames. Examples of this are making sure your patients are getting their preventative services, making sure diabetic patients are having their A1C checked, or making sure your patients are getting their annual flu shots. Documenting all care in the patient's medical records. If you do it, document it. Be as specific as possible with your documentation. Instead of documenting last pap smear was 3 years ago, document that the last pap smear was performed in August of 2014 and the results were normal. This will eliminate a request for records. Submit claim encounter data for each and every service rendered, regardless of the contract status. Similar to what I just said, if services are performed, file them with the insurance company. Ensure that claim encounter data is submitted in an accurate and timely manner. Timely filing is 180 days for participating providers, but that does not mean you have to wait to submit your claim. Code to the highest specificity. Consider including CPT Category 2 codes to provide additional data and reduce medical record requests. CPT 2 codes are tracking codes that facilitate data collection for the purpose of performance measurement. Use of these codes can help identify gap closures. Responding to our request for medical records within the requested time frame, we understand that requests for medical records can get overwhelming and that we are not the only ones making these requests. If there is ever anything that we can do to help ease the burden of your staff, please feel free to contact us. We will come copy records if needed. We will drive to your office and pick up records if needed. Just please let us know. So we as a health plan have dedicated staff in place working to improve quality. An example of some programs that we offer are Member Connections representatives who offer services such as Home Connections, which consists of one-on-one home visits to educate the member about PCP visits, preventative health services, appropriate use of urgent and emergent care and community resources. Case management screenings identify members with great needs who can benefit from these programs. Disease management programs for such conditions as asthma for pediatrics and adults, coronary artery disease, diabetes. We actually run reports of members diagnosed with diabetes, and if we have not received a claim for an A1C, we will then reach out to the member and work with them to establish a relationship with the PCP to manage their care. Hyperlipidemia, hypertension, low back pain, and tobacco cessation. Start Smart OB Case Management. The goals of this program are to identify pregnant members who are at risk for preterm birth, potential adverse birth outcomes, and pregnancy complications. We will develop an OB care plan in conjunction with the member and the member's practitioner to provide an ongoing evaluation of the member's risk and needs. Pharmacy programs. We help provide access to pharmaceutical services for eligible members to ensure that services are covered, medically necessary, appropriate to the patient's condition, and rendered in an appropriate setting. Educate providers regarding cost-effective usage of drugs and to provide feedback about current prescribing patterns to improve quality of patient care. We also have an exclusive pharmacy lock-in program that was implemented in order to detect and prevent abuse of the pharmacy benefit as restricting identified members on one specific pharmacy and controlled substance provider. These members are also offered case management services and education. The list is reviewed annually, and if the member is compliant, we will remove them after 1 year. A medication adherence program in place to reduce emergency room visits and inpatient stays. Part of this program is a letter campaign to members that are identified as non-adherent with their diabetic, hypertension, cholesterol, antiretroviral, psychiatric, respiratory, and epileptic medications. It also includes educational articles placed in the member's newsletter and outbound calls to the member regarding medication adherence. A program to reduce emergency room visits. Members with 2 or more visits to the ER in a quarter receive a packet with a letter to educate them of appropriate symptoms requiring ER visits. They are also provided with a magnet with contact information for our 24/7 nurse line and a list of urgent care centers. Members have the ability to earn up to $200 on their My Health Pays reward card for activities such as completing an Ambetter well-being survey during the first 90 days of their membership, getting an annual wellness exam with their PCP provider, and receiving their annual flu shot. Members can use their reward money to help pay for monthly bills such as their utilities and cell phones, or for health care related costs such as their premiums, medical co-pays, deductibles, or co-insurance. Ambetter offers a pay-for-performance incentive program. This program rewards the provider for ensuring that their Ambetter patients receive preventative services according to clinically recommended schedules and for helping with the management of their chronic conditions. This is an opportunity for additional reimbursement with no downside to you. Program details. This program is only being offered to our participating primary care providers. As a participating Ambetter PCP, you are automatically enrolled in this program. The incentive amount is an additional amount, is in addition to the contractual reimbursement you receive for providing services to your Ambetter members. A recent mailing has gone out to all in-network primary care physicians with detailed information on the P4P program. Please contact provider services if you did not receive a copy. Ambetter members are directed to select a participating primary care provider at the time of enrollment. In the event that the member does not make a PCP selection, Ambetter will select a PCP for the member using the following criteria: a previous relationship with the PCP based on the member's claims history. What we do is if a member has not selected a PCP within the first 30 days of being enrolled with us, we will review their claims history to determine if a PCP visit has occurred, and if so, we will assign the member to that PCP. If we have not received a claim from the PCP for the member, we will then look at the geographic proximity of the PCPs to members' residence. The auto-assignment logic is designed to select a PCP for whom the members will not have to travel more than the required access standards. We will take into consideration the appropriate PCP type. The algorithm that we use will look at the member's age and other criteria to identify an appropriate match, such as a member under the age of 18 will be assigned to a pediatrician. And our members can change their PCP at any time, with the change becoming effective as early as the next business day. You can always use the PCP reports that are available on our portal to view the members that have chosen you or have been auto-assigned to you as their PCP. These reports are generated on a monthly basis. Included in your patient list are the member's care gaps, a flag if the member has had 3 or more emergency room visits in the past 90 days, and disease and case management detail. We have partnered with a company called LexisNexis to validate the demographic information that we have on file for our practitioners. Some of you may have already been notified by them. Please make sure that when it's requested, you update your profile with LexisNexis or on the AMA portal. There are a number of reasons we validate this information with you, including to provide our members with accurate information through our Find a Provider tool on the website, to allow our members to locate and access the care and services that they are needing from in-network providers, to help other providers make referrals and accurately direct their patients' care to in-network practitioners and providers, to ensure that payment and other correspondence are received timely and reduces the potential for delayed or denied payments resulting from inconsistent demographic information, to ensure that we meet the regulatory standards set by the Centers for Medicare and Medicaid Services. As of June 2017, Ambetter will now recognize physician assistants, something that we have not previously done. If you are currently contracted through a delegated entity, we have reached out to that organization for a complete roster of physician assistants that are currently credentialed. If you are directly contracted with Novices Health for the Ambetter product, in order to be a participating practitioner, you will need to complete an Allied credentialing application. This is the same application we would have sent for a nurse practitioner. If you would like to request a copy of the Allied credentialing application, please contact us at the phone number or the fax or email listed. You may bill multiple E&M codes on the same claim for visits that occur on the same day. By using the 25 modifier on the E&M code, the practitioner is indicating that a significant and separately identifiable E&M service was performed by the same physician on the same day as another procedure. For an example of this billing is a 99381 well-child visit and a 99211 sick visit with a 25 modifier performed on the same day by the same physician. Please note that the modifier 25 is subject to the code edit and audit process, and that appending a modifier 25 is not guarantee of automatic payment and may require submission of medical records. And also note, a 25 modifier is not appended to a non-E&M procedure code such as lab. Some important reminders. Please remember that all authorizations are done at the procedure code level. This is a screenshot of the print-off needed tool that sits on the public website. It is located under Provider Resources within the For Providers tab. There are 5 simple questions that must be answered before you will be able to enter the procedure code in question. It is the responsibility of the provider to verify if a procedure needs authorization prior to services being rendered. Clinical and payment policies are posted on our public website. To access policies, click Clinical and Payment Policies in the For Providers section of the website. There is a link to the policies at the bottom of each section. Click the link to take you to the policy page. This is the contact information for our provider services and credentialing department, as well as the URL for the Ambetter website. We have also included contact information for our Director of PDM, Credentialing and Provider Network, Kelly MacArthur, our Credentialing Manager, Rebecca Wilson, as well as the 3 Provider Network Specialists, Mike Hackbart, Carrie Murphy, and myself, Belinda Perkins. We do ask that you please contact Provider Services for normal day-to-day questions such as eligibility inquiries, claim status inquiries, etc. We will now go over the questions received during the presentation. If you have any additional questions, please submit them to the email listed on the screen. We would appreciate it if you would start the subject line with Provider Webinar so we can direct your questions to the appropriate person. Also, if you need a certificate of attendance, please send the request to the same email address. Thank you so much for your time today. Have a great rest of the day. We're going to remain on the line for a few more minutes in case anyone has any questions. Rashana Winfrey has a question. Is there a way I can print information provided today? The information will be available on our website in a couple of weeks, but if you will send us your email address, we can send you a copy of it. And if you don't want to send us your email in the chat, you can send us a copy of it to the email listed, contact_us_provider_ar@centene.com. Okay, I'm going to go ahead and disconnect the line now. Thank you guys for joining us today.